All right, let's get started. My name is Jim Wadley. I'm the Chief Information Officer for Access Health Connecticut. I'd like to take this moment to say thank you. Thank you for all of you for coming out this evening. I know it's a lot in your day. It's a lot in all of our days to take the time out to come and take a look at some of the work that we have been putting together for the state of Connecticut. I'd also like to take this time to say thank you to Middlesex Community College. For me, this is the first time I've been living in this state for 20-something years. I never knew it was here, and I could probably sit and stare out that window at the view out into the Connecticut Valley, Connecticut River Valley. So this is a wonderful campus, and I just want to say thank you to Middlesex for allowing us to use their facilities. So I want to craft this evening's events a little bit for all of you so that we can kind of figure out how everything's going to work. But before I do that, I wanted to introduce a few of the people, and I was expecting a couple more to be here, but they have not made it. But working with me this evening is Jason Madrak. He's our Chief Marketing Officer for Access Health Connecticut. He will be sitting with us as we get to our Q&A later this evening and be able to answer some of the questions. I would not be surprised to see Kevin Coonahan walk in as well. He is our Chief Executive Officer for Access Health Connecticut, and he too will be participating. Margot Lakowitz, who you met on the way in, has done a phenomenal job of hopefully answering all of your questions about this evening, setting up this wonderful space, and making everything here work. If you were able to find the room, you can thank Margot, because I walked in behind Margot about 5 minutes, I didn't find the room yet, and I went to the library downstairs. So the fact that you are here, you can thank Margot for all this, as well as the staff that are helping support us from an audio and visual perspective. So what will you see tonight? So I want to craft a little bit what and how we're going to present this evening. Because there's so much that we could show you, we kind of had to pare it down a little bit so that we could squeeze it into about 45 minutes to an hour, so that we figure it would allow everyone to ask questions after that. So what we've done is we've taken a family of three, 2 adults and a child. That family, which is indicative of what we think many of the people coming through the exchange at the beginning may qualify. The 2 adults will qualify for advanced premium tax credits, excuse me, and their child will qualify for Medicaid or CHIP. You will also see the screen flows for our comparison shopping tool. What that will allow our consumers to price, compare plans, and enroll in those plans as well. With those determinations that are going on I'm going to back up for just a second. I missed a part about the family of 3. With that family, you will see the screens. For those of you who are familiar with the Affordable Care Act, those screens are considered the streamlined application. It is a process that all of the states are leveraging from the federal government. We all put our little nuances around our marketing and some other small pieces that we think that are the nomenclature in the Northeast, and more specifically Connecticut, will work better, but it is the single streamline application. That application, I've read many articles, and there have been many questions around that application, so I want to make sure everyone understands a little bit about that. The way I describe it to my friends is take TurboTax, and all of you go crazy about, and you're all doing it right now, TurboTax, as we're trying to figure out our taxes. Healthcare is just as complicated. We are trying to take the same complex process through this single streamline app and make it easy for a wide group of individuals to understand how to walk through. So that's what you will see this evening with our demonstration. Now, our demonstration is not a working demonstration. And so what I mean by that is we're still developing our application. And so what we've done is taken screenshots of all of those screens. This is normal part of our design process. This is what we hand off as documentation to our systems integrator to allow them to then go on and develop those screens. So thus you will not see in this working click-through application, you'll see things that we're using a special tool that allows us to do a demonstration, but we encourage feedback that you have related to that, because what you'll see in this is right now probably 90% or so of the way we feel the system is going to look when we roll out in October. So what we want to do is make sure you let us walk through the entire presentation. We think it'll take about 45 minutes, plus or minus 5 or 10, so that you can experience the screen flows as they're going to work. We've tried to leave the last hour for questions. I'll say that we will stay around as long as you have questions. We will try to answer all those questions, so don't feel that you're rushed for 7 o'clock. Now, with all the feedback that we are encouraging you to share with us, what I want to remind everybody is, from a project perspective, we have a hard date of October 1st. So all the feedback that we are receiving, we're working with, in the crowd, some of the consumer advocates that are part of our advisory committees. We are taking all that feedback that we receive. Tonight with us as well, we have Pappas McDonnell, our marketing firm that is helping us to synthesize some of that feedback. We have some of our Deloitte consulting design group that is helping us synthesize some of that feedback. And then we have our own marketing team that are sitting around in this room to help synthesize some of that feedback. Now, is it possible all that feedback is going to end up after this presentation? No, but we take it all very seriously, and I want to encourage you all to share it with us so that we can make sure that we have an application that is the best that we can deliver for the citizens of the state of Connecticut. Now, the last thing that I want to say is next steps. So after this, so clearly this, as I said, this was not a working application. The next steps over the summer is we will start beginning, our marketing team will host focus groups. Those focus groups will bring what we think will end up being users of our system, all the users, wide, broad range, and they will get to work with our working application. We think of someplace in the June timeframe. We'll get some of that feedback. We want to make sure that there aren't any major misses or things like that, so that we can quickly incorporate them back in before we roll out in October. So there'll be lots of opportunities for feedback from the public, feedback from our focus groups as well. So again, I'm encouraging everyone, we want to hold your questions so that we can walk through the presentation, and then we'll spend time afterwards answering questions that may come up. All right? So with that, I want to introduce Tim Box. Now, up until about 6 hours ago, Tim thought he was just coming to work today. It's the person that was supposed to be helping us, like many of us in the organization, there's a bug going around, and we're all fighting it off. She was not able to make it, so Tim has been volunteered to help us walk through tonight's presentation. So with that, Tim is with Deloitte Consulting. Tim will walk us through from now, and enjoy. Thank you very much.
Well, all right. Well, thank you, everybody. Glad everybody could make it out here. As Jim said, I'm Tim Box from Deloitte. And like he also said, 6 hours ago, found out that we'll be going through this presentation. So I think, we shouldn't have too many problems, but, we'll go through this. I also wanted to introduce Ashley, who will be helping out with the navigation on the screens here. So let's just jump right into this. Jim gave a really good introduction, actually, about the lay of the land, where we're at with this project. What you're seeing here is actually the Access Health CT home portal. So this would be basically where the clients come in first. A couple of things that we want to point out about this is really one of the places, this is your first entry into the Access Health CT website, right? So one of the things that we want to say is we really wanted this screen to be a place where you could explore your health insurance options, opportunities for financial help through Access LCT, this screen and the entire site will be available starting October of 2013. One of the things that we want this site to do is actually help help educate clients about this. So one of the things you can see across the bottom is clearly you can see the apply for health coverage. That's one of the main activities. But find assistance. So I think many of us are familiar with the broker navigators, other forms of assistance that clients can get. So we wanted that to be very upfront on the home screen page so you could get to that right away if you need that kind of assistance getting through this process. And then one of the things that happened when we jumped into this, if you can see at the top, is you can see the login up here at the top. So this is Ashley Jones, and in this particular demo, what we're going to go through is a process where Ashley has already created a user account, and she's going to log into this system. So we're going to skip a couple of steps in terms of that login process. But what she would have done is she would have provided some light information about herself and also answered some challenge questions in case she lost her password later, things like that. So at that point, she would go ahead and press login. And here's another thing that you'll see throughout the application. This is our Start Your Application page. If you saw that brief highlight here, that's one of the things we'll talk about in just a second. But as we get into this Start Your Application, every section of the application that we're about to go through, and there's these sections across here, each one of these has a landing page. And we wanted that to be kind of non-intimidating for the client. We wanted them to kind of get a feel for what's coming up. So not only do we have one as a mask for the entire application, you'll also see those as sections at the start of each one of those, and I'll talk about that in a second. But over here on the side, what you can also see is this what we call like a wayfinder, basically, throughout the application process. What we'll go through today in the scenario that Jim talked about is going to be a very full data collection. Hopefully you'll see that even though it is very full and you're going through a lot of the screens because we wanted to show them in this presentation, other clients who are able to answer questions up front would not necessarily have to go through each one of these. So we won't actually show that today, and you're going to see them actually go through that entire piece. But do keep in mind that as clients are able to answer certain questions up front, the entire premise of the way that we've sequenced these questions, things like that, has been so that those clients can skip questions that they don't need to be asked. We'll go next. So as we were talking about, you saw that kind of wrapper page over the entire application. Now we're actually getting into what we call like the build your household. So this is one of the start pages. And what you can see here is coming up in this section. So we've tried to find some user-friendly ways to give them a little bit of guidance about what's coming up so that they're not just blindsided. They have a little bit of an idea about what they'll have to accomplish. And then over here, the idea is to give them basically a list of things that they may need for that section. What this is doing is that this, as Jim mentioned at the start, this is complicated. There are things that you need, and we've tried to make it as simple as we can, but at points where you're going to need certain things, like in this instance, birth dates, social security numbers, things like that of people, we go ahead and try to prompt you for that so that you can expect it, so you don't just land on a page and get there and say, you know, what is this, or I didn't realize that was needed. So giving them a little bit of a heads up of what's going to come. All right, so here you can see Ashley is going through a process where this is the very beginning of the application, and that was very subtle, but if you saw in that box there, she clicked up, she moved up. So it said basically, if you can read that, it says how many people are in your household, including you, even if they are not applying for insurance. So what that screen is basically doing is this is providing a way to start the process, and you'll see that this kind of feeds some dynamic aspects of the application later in the sense of now that we have that 3, it's not that you can't change that later, but we'll prompt you with 3 basic like templates everywhere that we need to know about individuals, things like that. If there's a higher number, that number would be the adjustment. All right, so we'll pause just there for a second. What you can see here is we're jumping into this question of, do you want to find out if your family can get help paying for health insurance? And let me just stop right here for a second and talk through this one. It's a biggie in terms of the overall application, so we want to be very explicit about what's going on here. As Jim mentioned with that TurboTax concept, with the kind of consumer-friendly aspect, we have an entire array of users that are going to be coming through this website, from people that need very big forms of assistance to others that may just want to be coming through to get that shopping experience completed. Working not just in a vacuum here in Connecticut, but also, as Jim mentioned, that federal streamlined app and pieces like that, one of the things that they identified was actually this gate question worded pretty much exactly this way, which is basically allowing clients that don't want to apply for subsidized programs to indicate that they don't want to do that up front. And at that point, they would just move through a couple of questions, and they could, if assuming that they're eligible to participate and meet those minimum criteria, they're going to be able to go straight into enrollment. Here, though, in our example with Ashley, Billy, and Mary, Ashley is going to go ahead and mark that, yes, she does want to see if she could get help paying for health insurance. And at that point, we're going to take her through a much fuller data collection process than would otherwise be done for that person that's just coming on to purchase insurance without any kind of subsidy. So as you can see, this is one of those areas where we talk about the application being kind of dynamic. So what we notice here, right, is that household member of one of three. So when she indicated that there were 3 members, she's prompted with 3 templates. But you can also see down here, she's still given the option to add a member. This is very basic information collection that we're doing at this point. We're just trying to get some basic demographic information about these people. You can see we've entered the date of birth, the gender, those types of information. All right, and now, as we're moving into what we call like individual details, you can see that we're going to go, sorry, I got feedback. We can go through here. You can see that as Ashley's entering in her SSN, we also have this box here, and I want to talk about that just for a second. So this box actually says, I consent to having my SSN used to retrieve information from secure external sources. What we do with that is actually one of the main goals of this application is to use these online sources. So I think many of the people in this room are going to be knowledgeable about the fact that the federal government's providing what's called the Federal Data Services Hub, which is a way to get a lot of information online without the client having to provide it, where we can go in, verify things like incomes, verify things like citizenship, all of these things so that we can go ahead and move them through. There's a lot of data passing back and forth behind the scenes, but these clients shouldn't really be asked to provide that if we can avoid it. They should just be asked to kind of attest to certain information, and we should find out on our own whether or not that's true. If that's the case, then they should move through, and they really shouldn't be aware of this verification process. They shouldn't feel it, to be honest. That's one of the goals. So all this verification is going on, all the legal requirements are being met, but unless there's some kind of difference between what they've said and what we're seeing on these electronic sources, they should move through this almost like a commercial site. I mean, really like a commercial site, that's the goal. So what we've done here is we say, I consent to having my SSN used to retrieve this information, and that's very important, so I just want to point that out. I mean, we wanted to be pretty explicit with clients that, this is something where you're indicating it's okay for us to use that SSN. We know about privacy concerns, things like that. So it's just one of the things that we want to point out there. All right, so beyond this, we get into actually answering a few questions about household address and contact information. This will look fairly straightforward, but you can see a couple of things to note on here. One is we ask about her home address, and then if you saw that, when she clicked that her address was the same, it dynamically said, okay, I understand that, it's going to use the same address. And then below, there are a couple pieces that I want to point out. If you can see this below, it says, want to go paperless. So I think many people will be familiar with how this works in the ACA, but we go ahead and provide clients the option to go paperless, but I think a lot of people in this room will be aware that there are certain still regulations where we have to send a paper notice to people. So this is, you want to go paperless, we understand that. In instances where we can, reminder notices, things like that aren't quite as binding, we can go ahead and do that through the email address that you provide. If on the other hand, it's an eligibility determination notice, if it's a renewal notice, things like that, some of that has to be sent to the client via mail. So this is kind of asking a question, to get them there, but they still may get notices in the mail. The other thing that's very faint that you can't really see but is here is a couple of these question mark icons will be showing up here sporadically throughout. These are actually links out to help text, so clients will be able to use those to get out to help. So in instances in our prior screen reviews where we've looked at this and we've seen questions that were maybe a little bit difficult to understand right off the bat, things like that, we've gone ahead and added some of those question marks, and those are help texts that we'll work with the marketing team, other folks throughout to kind of make sure we've got that text right in a readable way that people can understand what's being asked of them. All right, so now we'll get into something that may be a little bit actually foreign to some people because it's very faint in the process of the ACA, but it's also very important to it. So what you can see here is actually this, we call this screen the Confirm Your Identity screen. What you have to do here is basically, thinking in mind that these people are on the internet. You don't exactly know who they are. It's required that we go through what's called an ID proofing process. And the main thing to take out of this as you're thinking about it is we're required to ask you questions that are so-called out-of-wallet questions. In other words, somebody steals your wallet, you still shouldn't be able to answer these questions. So the basic premise behind some of these, and many of you may be familiar with this through like setting up a bank account online or some kind of credit card online, you're going to get these questions that are basically stories about your life a little bit, in the sense, so, these are just a sample, but CMS and Experian are actually offering this as a service off of that Federal Data Services Hub that we mentioned. And so we call it with their SSN. So again, that client allowed us to use that SSN, and this is one of the first points where we will. And we're prompting them to go through this identity proofing process. They'll get questions about themselves, and then they'll respond. And that's the general premise behind that. It's a little more complicated, but we'll leave it there for now. All right, so getting into individual details. As with the other sections, as we talked about like at the beginning of Build Your Household, here you can see we've set up with what's coming up in this section, a brief text about that, and also again, the hopefully familiar items that you may need, and also this time estimate, if I didn't raise that earlier, we try to give the client some kind of idea of how long they can expect to take to get through this section. Next slide. One of the things that I didn't mention actually on the previous one, but it's okay, is we actually, if you hadn't noticed it already, there's a couple of ways to get help throughout this system. So here we have the the Access Health CT call center number. That'll be updated once that number is there. And you can also see that there's help text up here. Those will be links to FAQs, other forms of assistance that people can get to go ahead and get that help if they need it. And those are available, as you can see. This footer is available all the time. So is the Get Help icon to get to there. So one of the things that we were very hopeful to do was to get people, if they ever get that overwhelmed feeling, if they're ever, they don't like this online process, not only do they have those two forms, but one of the other things that they have is this save and exit. So if they ever need to leave and try to seek out that assistance, things like that, they're not going to lose their place in the application. The system is set up so that any screen that I save and exit from will be the next screen that I come back to when I come into the application. All my prior data will still be there. So what we've gotten into in this screen, going back into the specifics of this, is household relationships. So in this section, we're collecting information about each member and their relationships. And we're basically going to need to know those relationships in order to establish how they're going to get coverage together. So we have to establish the family units. We have to look and see what are the relationships between the individuals, because up to this point you've just indicated that they're in your household. Now we need to get at and figure out all the complex relationships about who can get coverage together and things like that. So getting into a couple of questions that you'll see here. This one, state residency, and a couple that will follow this that we'll talk about in just a second. These are those minimum required type questions to participate on the exchange. So for instance, you need to be a resident of Connecticut, or you need to intend to move to Connecticut within a short time frame. So that's this state residency. So we took the address that Ashley entered, and we just have her go through the process of saying, yes, this is where all my individuals are. That counts as clarification that all the individuals are in the state and eligible to participate. We then ask another question about pregnancy. I think many of you, again, will know this, but pregnancy actually counts towards household size. So the number of babies that may be expected in a pregnancy actually count towards the household size, counts towards the federal poverty income limit that's going to be used to make their determination. Typically, the bigger that is, basically that will increase the household size, I should say, by that number of people that are pregnant. Here, Ashley's marking no, but if she were to mark yes, we would follow up with a question that would say, okay, how many children are you expecting, things like that, to actually get at that household size. So again, this is just a small example of one of those ways that, if you're not that family that's dealing with the pregnancy in the household, you're not going to be asked those follow-up questions. If you are, we're going to quickly prompt you for it, and it'll drop down here to get at that. I think as many of you know, there's a whole lot tied up in citizenship in relation to this, legal permanent residence, things like that. For the purpose of this scenario, we're just going to mark that Ashley is yes, but in instances where they're not, this would actually prompt for a whole host of other questions to get at all of the things that we have to establish to figure out if you can still participate in the exchange, going through that process. So again, for the individuals that move through this by being able to answer that, yes, everyone's a U.S. citizen. It's a very quick process they move through, but there are more detailed questions if we need to get those to get that full eligibility out. Tribal status, again, another one of these questions that if you don't see them or they come out of the wood, come out of nowhere for you. But I think many of you know that there's special provisions in the ACA about Native American status and also for Alaskan Native. So we have to ask this question in order to know if we need to ask additional questions later on and to apply certain rules that are actually in the rules engine that underlie the eligibility determination that we make. So if you mark no here, those rules aren't used, aren't looked at. But if you do, then we know that we have to go ahead and make sure that those specific points don't apply to you, things like that. And so now we get into some tax information. Let me just back up here for a second. Because we know that Ashley is requesting the help paying for health insurance, we're going to take her through a couple of questions to start with about her tax information. Going back to the earliest example when we talked about that subsidized versus unsubsidized, if that person had gone through that question and said, no, I don't want any help seeing if I can pay for health insurance, we're not going to ask you any of these questions about your income or your taxes, things like that. This is just for Ashley and her family, that type that's moved through the system and said that, I'd like to see if I can get that help. We're going to go through a fuller income screening to see where you may level out in terms of the programs that you're eligible for. Next, please. So this gets into a couple of questions that if you haven't seen them before, it takes just a second. What we want to talk about is, again, envision that this demonstration is taking place for the clients that will be applying in 2013 for potential coverage in 2014 in the case of advance payment for premium tax credit. The tax record that you have on file is going to be for 2012 at that point. So what this is actually doing is, in the ACA, Affordable Care Act, it actually says that you need to use prior tax income as a basis for determination where possible. So the way that they do that we follow here, and that's done in the streamlined app, is to ask based on your prior tax return, in essence, has anything changed? That's what it basically does. And do you expect, has anything changed now, and do you expect anything to change for the 2014 period that you're applying for? And the reason is because the IRS considers their own tax return information, which we get from the Federal Data Service Hub, a great source to use, and they say, please use that as the basis for the determination that you're making if it's available. So in the next couple of screens that you'll see, we're going to ask about your 2012 status to basically figure out, can we go ping this Federal Data Service Hub, get your 2012 information, and then make the determination that way. So here we're going to ask about Ashley Jones's tax status for the year 2012. And as you can see, she put a filing status of married filing jointly and indicated that she was the primary tax filer on this return. One of the things that's important for is actually in order to even get that tax information back, not only do you have to provide the SSN, but you also have to provide the tax filing status. That's one of their requirements so that they'll tell you back what the information is. And then, like we talked about, we say, will the tax statuses for your household be the same for the year 2014 as they were for the year 2012? What we're trying to do with this type of question is say, if you are the type that your circumstances aren't changing, there is a very streamlined way to get through this application for you to make a determination about whether or not you should be getting advanced premium tax credits. That's basically the purpose of this, is to move through there. Now, if they mark no, what's basically going to happen is that we and the streamlined app both follow a process where you basically get off of this APTC flow, and now we go into more full income screening to figure out, of all the types of programs that may be available, what is it that you may be eligible for? So if for whatever reason you're falling off, or however we want to phrase it, falling off this APTC route, it doesn't even mean that you're not going to get APTC. It just means that you're not on the quick flow to do it. You're probably going to go through a fuller income screening, and we'll show you some of that because in this scenario with Ashley, we indicate that she's going through that to actually get Medicaid. So we'll show that here in a second. So here's the part that we were talking about, and if you saw that here, you may have asked the question, how did you know that the income was $30,000? That's actually that call to the Federal Data Service Hub for that prior tax return. So here we're showing, we basically say, according to federal tax return data, Ashley and Billy's combined income was $30,000 in 2012. We ask you to say, is that correct, just in case there's some glitch or problem with that. If you mark that that's yes, Then we'd ask you about what do you expect, what do you expect the combined yearly income will be in 2014? And here Ashley's marked 31,000. So what that did actually, so even though they were able to move through that APTC flow fairly well, because of their income, we're actually seeing at this point that they're likely that somebody in the household may be eligible for Medicaid. So rather than keep them on this APTC flow, in the interest of making sure that they get the fullest coverage that they can get out of this process for eligibility, we'll go through a more thorough income screening based on just that little bit of information that we gathered prior, which was, if you saw, we gathered your household size based on all the information that we asked about, and we also gathered your income. So we have a pretty good idea of your situation, not a complete view, but we can make a determination that it makes sense to go ahead and put you through a fuller determination to see if you could get Medicaid, other things like that. So here you're going to see a series of questions where now that we've, in the system at least, now that we've figured out that we're going to have to go through that fuller screening, we're following up with a few additional details, and then in the next set of screens, as we'll show you, we're going to get into a fuller, maybe more traditional looking to some people here, Medicaid type screening for income, that's actually more current and that type of information. So as you can see now, we're going into this household income. Again, the typical coming up in this section, the things you may need. Here we bulk this up a little bit with more of the forms. That list will be changed as we get closer to final. But we're just truly trying to give you that information about what you're going to need before you get into this so that you're not overwhelmed as you're moving through the application. So here we ask a series of gating questions, and you can see Ashley's going to go through and answer these here. So what's happening is, this again is that same premise that we try to talk about. These income questions have a lot of detail behind them. So once you answer that yes, you have that type of income, we're going to have to ask you a fair number of questions about those. So what we try to do is we make the call that we would like to see, okay, should I even ask you about those? So if you can read those questions up from the top, are you or someone in your household currently employed? If the answer was no, you're going to move past the income questions. You're not going to get prompted for that. You're just going to move past it. And then what we do here is, if you saw that expansion as they went down, even still, we don't want to ask about individuals' income if we can establish up front that we don't need to. So we figured it was actually, and following a federal version of this too, you can see, please indicate any person who is currently employed, Ashley Jones. So what we have now, and you can put this together, right, is Ashley Jones is currently employed by a typical type of job, not self-employment, not other income. And you'll see in the next set of screens, we can actually prompt Ashley to say, okay, please tell me about that type of employment that you have, right? And I'm not going to ask about Billy's employment anymore, things like that you didn't indicate here. So as you can see, we asked about self-employed, and then we asked about other income. The next series of screens, you'll see 3 screens, and we'll go through those. Those are the places where they add all the detail about that. And that's where you get to that current income buildup to really figure out what the household condition is, what their income's like, and everything like that in the current month. So these will kind of play through here in a little bit. You can see Ashley's filling out these different types of income. She'll fill out the amount here. We ask how often. We provide any number of ways that you can calculate what that frequency is. And the goal is, in these ones like that, with the amount of 1,000 in the monthly, we didn't want the client to have to interpret it to a year for every type that they have. So we allow hourly, we allow different types so that they can just enter it the way they know it, and then we can try to build it up for them. And I'll show you the income review screen at the end that does the calculation for them. Similarly, so we had indicated that Billy had an insurance type of self-employment. So you can see his company there. And then the amount and how often, things like that income will build in. And then here we get to the final one of current other income. And again, we know that this may not be realistic, but we wanted to show the income screen so you could get a feel for all of them. So the likelihood that the family has all 3 may be a little bit off, but you can see Billy may have this Social Security benefit, and again, we can get this amount in the monthly. So as with the incomes, we then move to deductions. So there are a few types of deductions that may apply to the overall household income calculation that we may need to collect. We've simplified this a little bit, if we click next. So in this case, Ashley's going to mark no. She doesn't have any deductions. But the deduction screen are basically similar to the income. It's basically collecting the type, figuring out what it is, and then it gets reduced out of the overall income amount for the household. So as you can see here in the financial review, what we've done is we've collected those incomes. We've rolled everything up. So you can see that net income that gets built. So you can see the total monthly for Ashley, Billy, and their total of $2,500. And again, just before we move on, you can see that they have this option to edit, so they can go back that way. They can also obviously navigate back through these links too. So, they're not locked in. They can go and edit this once they evaluate it. So at this point, we've collected a lot of information. We're actually getting fairly close, though, to an eligibility determination. There's a couple of kind of wrap-up things that we need to ask about in order to make sure that the things that we think they're going to be eligible for are the things they're actually going to get. But even before we do that, I think many people here are familiar with the fact that in Medicaid, you can actually apply to get retroactive Medicaid 3 months prior to the date of application. So we actually try to make sure that that's being evaluated as well. We do that. Obviously, that policy is a little bit difficult to communicate to people that may be new to it, but the way that it can get communicated is we say, do you want help paying for medical bills from the last 3 months? We try to ask that question in a way that the client can kind of understand what the premise is. So if they were to mark, in this example, Ashley would mark no, but if the client were to mark yes, then we'll go through a series of questions and actually ask, is your income in the prior 3 months exactly the same as what you just indicated, in essence? And if they mark no, we'll give them the prompt to say which months may have it been different, and then we can actually take them through and do the full income for that too as well. All right, so at this point, you're going to see, and you can see kind of how far we've progressed through the application already. We go through a series of questions that we call additional questions. We do that because these questions are actually dynamic based on how you've arrived here. So these questions are actually based on a fact that we know a pretty good indication of the types of programs you're going to get on the eligibility. We still need to run the final rules analysis and make sure that you truly get everything. But based on everything that we've been able to collect to this point, we are going to have a fairly good idea about the types of additional questions that we're going to need to ask based on the programs you're most likely eligible for. So this next section is actually a little bit dynamic. In the scenario I'm going to show you, it's specific to what Ashley and her family have entered in this application, but it changes subtly based on how they've arrived here, the questions and the programs that they're actually eligible for. So for instance, right, in this scenario, it's going to be the case as we led off with at the top, that Ashley and Billy are going to be eligible for advance payment of the premium tax credit. Now, one of the things that you can't have, though, is affordable insurance through a job that disqualifies you from being able to get those. So we have to ask that question, and you can see the caveats that you have to ask in here, even if it's from another person's job, like a spouse. But about the affordability, Ashley in this instance is going to say no. And then we go through a series of questions. These questions are actually, there's only a limited number of programs that are actually administered through the Access LCT exchange marketplace. So what we have to do is actually figure out, does the client actually get other program types that may actually disqualify them from being able to participate here because they're already getting something. So as you can see from the top, we ask about, are any of the household members currently receiving foster care assistance, adoption assistance, SSI, and is anybody currently a full-time student? So these types of things that we're asking about are actually, what we're trying to get at is if you were to mark yes, we would go ask, okay, which individuals are getting that thing, and go through a fuller detail of that to make sure that nobody's getting like dual benefits, things like that. We try to avoid that up front if we can, if they can attest to that. And then finally, as you can see over here, we're getting very close to the actual eligibility determination. You can see that here we're on a your signature page. These statements are actually a little bit dynamic based on how they've arrived here again. We're going to want them to attest to certain things before they sign that application. So those 5 statements are there. And then Ashley has the ability to electronically sign her application. And then here you can see that although that happened lightning fast, they've actually gone through the eligibility rules. A determination has been made in the back end, And as you can see, it went kind of fast there, but you can see the programs that they were made eligible for. So a couple of things on this is we actually list by person, and we give their age just to make sure we can keep them separate in case somebody had the same name in the household. But you can see the program type that they would be made eligible for, the status, of eligible here, the explanation, and that's really tried to find a plain text explanation of what that program is about. So you can see Mary is able to receive free or low-cost health insurance through Medicaid. And maybe you can also see more clearly up here, in the instance of Billy's APTC, he was eligible for up to $1,200. And then we give that plain text about, Billy's able to receive up to $1,200 to pay for health insurance between 1/1/2014 and 12/31/2014. So at this point in the scenario, Ashley would go through, she would look at each one of those types of programs that she was eligible for. She may have questions, right? So one of the things that she can do is actually, there's a link here to what's called like subsidized programs FAQ. So she can get a little bit more information about what those programs are, what they mean, what the impacts are, things like that, before making her selection. The other thing you can see here is, again, as we talked about, the state-based exchange only does the eligibility for MAGI-based Medicaid and CHIP. So as I think many of us know, there's other forms of Medicaid that are out there that don't have to do quite as much with financial aspects. So this gives them a place to actually go to a different system, and actually there's a link between those to figure out the final determination for those other programs as well. So trying to give them that full aspect of everything that they could be potentially eligible for. And then the other thing that we wanted to make very clear, and I think many of you that have read the regs and the clarifications that have come out, is the appeals process. So as clients view this eligibility determination, we want to make it very clear in the same screen. Here's where you can go if you feel like this decision is not correct. The appeals process that can be done, and the next steps that can be done on that. Also, for the notices that we'll send out for the eligibility determinations, they're also going to have very clear language about the appeals process, the next steps for that. Those will all be a part of it. So at this point in the scenario, Ashley moves through and she makes her selections for each one of the individuals on the application. So here she's selecting that she does want to accept the APTC for Billy. Up top, she had accepted it for herself as well. And then Mary Jones, she did accept the Husky A, so that's been selected as well. So that was a very quick introduction. We'll maybe pause here just for a second if we can before it moves on. That was a very quick walkthrough of the application process, but as you could see, they were able to move through fairly quickly through that application. And then the thing that, there were two outcomes, if you notice that. There was a Husky A, and then there was the APTC. So we'll talk about the APTC part in just a second in the plan selection up here, so that you all know, in terms of the Husky A, that would actually be routed out to the Department of Social Services agency for them to pick up. So they've been indicated that this person's been made eligible for that, and they will enter that into their system, and the person will get that Husky A through that routing mechanism. So that's all. You'll see that they have to confirm that here in a second, and we'll show that. But one of the next things that we do is we actually take Ashley and Billy into what's called the Explore Your Options page here, and this is actually the enrollment section. So in this Explore Your Options, she's going to be presented with a couple of different things. So you can notice that the plans have been listed out here, and it's very faint. I don't know if you can see it, but actually the amount of the estimated monthly premium here, this $150, there's actually some text here that actually shows that it's been reduced by that $100 per month amount that was granted as part of the APTC. So they're made aware of that here. They can see that. And then you can also see that we've kind of made these carrier names anonymous for the purpose of this demonstration. Those would be filled in with the actual carrier names, the plans, things like that, and then their own pricing information as that would come up. Down the left side, you can also see a couple of things here. One is a series of filters that we'll show here. Go ahead and play that. Yeah, thanks. So as she's going through and evaluating these, you can also see these filters that come down the side. So this Explore Your Options gives the client quite a few ways to go through and look at those plans that they may want to evaluate. And you can also see they have the option to choose how much of the, just disappeared, sorry. They have that option to choose how much of that APTC amount that they want to take, because that advanced premium tax credit amount that was given is actually the max amount. They're not required to take that. They can actually take less if they want to. So this slider bar on the left side that was there, that actually allows them to reduce that if they don't want to take the full amount. Moving towards this plan selection piece, actually. You can see that as she went through, she actually chose a couple of plans to compare. So she had clicked this add to compare on a few of these, and these are now showing up over here. And then she'll have this option to go ahead and say, I want to compare these plans. So we'll click on that. And as you can see now, these plans are listed out side by side. There's quite a bit of information listed out here. In this particular scenario, she's going to look, and after making a full evaluation, we've kept all these numbers the same. Obviously, those would be slightly different, in the real world. But here in the final part of this, she's going to go ahead and say, I'd like to move forward with purchasing Carrier C's plan. And then here we get into basically plan summary. So we have the fact that the Husky A was selected all the way back from the eligibility screen. And then we have the fact that they picked the Carrier C, the PPO for that. And at this point, that's basically the final confirmation for their plans that they've chosen. And at this point, they would proceed to the account home. And that basically forms the end of the enrollment piece of this. And that's basically it.
Want to open it up to questions. I know that there's going to be people walking around the room. There's a lady out here. I see your hair go that way. And we'll okay. We have more than two, and shocker, which is good. We want to hear them. Find somebody, and let's go.
Right, am I first? I have a couple questions. I'll just maybe throw them out, and then you can handle them however you want. Will the application be available in different languages out of the box? And then SSN, what happens if they don't check that permission box?
So can I start?
Sure.
Only because it's the end of the day. Can I hit your first question first? Yes. So out of the box, we will be rolling out with English and Spanish versions of the site.
Okay. What happens if they don't check that SSN permission box in the beginning?
It'll make the process incredibly cumbersome.
So do they have to keep putting in
It
their
becomes
SSN
paper
numbers?
attestations, it becomes paper attestations that individuals then have to be validated for. One of the things that we've already received feedback is we want to make sure people check. We need to do something a little different around that we've received feedback to make sure people understand what happens to them when they don't enter their social security number. So that piece I would expect is going to change.
I have two questions as well. First of all, the information has to go out to the IRS, Homeland Security, Department of Labor. Is the state going to be ready to do that?
Starting next week, we begin testing against, Tim talked about it, it's called the Federal Data Services Hub. It's a new process where each one of those, I don't want to go too technical on you, but it's just a question, at a high level, it's a question that goes out to Federal Homeland Security. We get an answer, it comes back. Are you a U.S. citizen or not? It goes, so each one of those things, Homeland Security, IRS grabs those things. We begin testing of that next week.
And then just a second question.
So yes, we'll be ready.
Thank you. The second question is, there was a point there where you said there's a box to check, question, is your health insurance affordable? But there was no reference to, I think it's what, 9.5, or it was just a generic question. I mean, I could answer my health insurance isn't affordable. Everybody probably could, right? As of today. So is that just going to be the generic question, or are you going to have a guideline for people to answer?
Yeah, so there's a part of that definitely needs to be looked at in terms of a couple of FAQs. So there's things like those question mark icons that we talked about in a few other areas, but right now it's a discussion point that we need to look at to make sure that we're making sure people can understand it.
So most of what we go through when we get into, so I talked about earlier, focus group testing that we'll be working with a hired marketing, with Pappas Mcdonnell, our marketing support agency, to all of those things. We're going to be pointed at that to find out what works, what doesn't work, what nomenclature do we have to change in order to make people, so they understand the process easier.
You went through pretty quickly at the end what the insurance options would be. Is that all the detail that you're going to give to people? I thought that was very limited.
Can you give me an example of something?
You didn't say, you put up 3 copays in and out of pocket maximum, and there really was not, didn't say what those deductibles apply to, didn't say anything. You know, there's a lot of information there.
Right. So each one of those things, no, there will be, I didn't mean to, hope I didn't put you on the spot. Yes, yes, there will be more information. You'll be able to go down to each one of those plans. It'll be their complete plan design. So for those people who are familiar with your health insurance carriers now, when you're out selecting, every piece of that information will be available on our site, that they will be able to go down, see all of the copays, for instance, all the deductibles, if that's what the carrier's plans are offering. And for those of you, if you've been watching our feedback on our board meeting, our standard plan designs were just approved last week that covered a lot of that information of what we would expect at a minimum for our carriers to offer. So there'll be a heck of a lot more information. Yes, we did go screaming through that process, but there'll be plenty of information there. I would expect, from my experience, I've been in this industry a long time, there's going to be more information than people can even absorb, and how we figure out how to help them is some of our challenges right now.
Over here, I think. Is there an ability to browse without answering all those questions?
Yes, so one of the things that we did not show this evening is what is called anonymous browsing. Anonymous browsing allows anyone to come in similar to any other website. If you were to go and say, I want to look for whatever, car insurance, you don't have to enter your information, but it'll get you to a point where it'll give you some samples of roughly what insurance would be, the plans that are offered and such. You will not need to register to be able to do that.
One other quick question.
Sure.
You ended it pretty quickly. Is there a here's what happens next? Congratulations, and there's all
Yes, there is. And so on this example right here, where we had our carriers, there is a plan. We're continuing to work through. We haven't finalized all of our options with our carriers at this point, but there will be, here's what happens next. And so for the group, what I would expect to see on that screen as to here's what happened next is the exchange is not going to be gathering payment. So what would be there is expect a letter from carrier X, and we'll have the time frame that you should expect. If you don't, here's a phone number to call. They'll look for payment in X number of days and things like that. We would expect all of that to be in a statement of here's what happens next. Yes, in the back.
We went through the application process, didn't click on deductions. Are you going to look for the applicant to determine what their deductions are? Is it going to be based on this year? Is it going to be based on 2012? What's that process going to look like?
So I'll make a stab. So my opening salvo of taxes, it's that time of year. So the premium tax credit, advanced premium tax credits go against your tax return on the following year. So you're in essence taking a loan out against what you would think you'd be getting back in taxes. So if you don't enter deductions, and that would change your filing status, then ultimately what happens is it would impact you when you get to next year's filing status. So that's one. Two, to go for a little farther into your question, if you don't enter deductions, what would that do for impacting how much your advanced premium tax credit would be?
Yeah, generally, the purpose of the deduction is going to bring your income down, going to make you, say, more eligible than you might otherwise be. So that's the basic purpose of the deductions. As Jim was talking about, on the APTC, there is this kind of true-up mechanism built into the entire thing of what you stated is obviously a future projection. If you're wildly inaccurate about what you project, you're going to get caught in terms of the tax that you file, and your refund's going to be reduced in the following year. So you do itemize it a little bit, and part of the thing that we've looked at with this, because your question is spot on, let me tell you. So, part of it is a challenge of saying it's a future projection, but there's really not a clear guidance about how you're supposed to be accumulating that for, how do you project a deduction that you may take in the future. So there is some attestation. We've asked some questions to follow up on that, so it is a point that is well asked, so.
I noticed there was a rating at the end when it showed the different carriers. Where are those ratings coming from?
So the ratings that we are going to use when we roll out are going to be the NCQA ratings that are published as part of, and I know someone's here from the insurance department, but I think it's part of the Connecticut Insurance Department has those ratings as part of NCQA.
And then I just had one more other question. If someone starts the process and they haven't gone in there for a while, are you doing anything to remind members that, they're still in the process? Like, are they being notified, or does it just sit out there?
So there is a notification process. We're looking at how those clients might be reminded to go ahead and follow up with that application. If they've indicated that they went paperless, if they made it at least that far, we could do it as an email notice. And then we're going to look at some written notifications for that too.
First question is, why would you give them the option on the Social Security number? Given that it's so critical in the whole process, and given that it's going to have to be provided no matter what, why would you give them the option? Why wouldn't that just be part of the application process or inquiry process? And secondly, I want to be really clear about this issue of how you're going to determine what their credit is. They're applying, let's say, at the end of this year. Their most recent tax return is 2012. And you're asking them to provide, let's say, current income. But you're saying that their subsidy is going to be dependent upon what their actual 2014 results are? Is that the case? I want to be clear about that.
So let me answer I believe your first question around Social Security number. It's a federal, what is there is a federal law, which is why it's there. One. Two, as it turns out, not everyone has a Social Security number that's going to come through the process. We have to do something to highly encourage that. And so the things that we have been having conversations with the federal government, we're going down next week, that we'll have, I'm sure, some of that around that conversation is how do we make sure that we want to be successful. We want our customers to be successful. Entering your Social Security number is going to make life a heck of a lot more successful unless you do that. One. Two, your second question. Thank you. I'm going to pull the IRS trump card again and say we're getting back into tax law, and what we're trying to do is work the process the best that we can. I'm not going to sit up here and say this is the best way that we can do it. It probably is the best way that we can do it, and it's not the easiest way to do it. Yes, to answer part of your question, everything that you get in 2014 is going to be based on your income in 2014. It just happens to be because that's what your tax return is going to be the following year. It's all, you're taking a loan out against your refund when you get advanced premium tax credits.
Jim, if I could, maybe I'll just add on there a little bit. I think one of the really challenging parts of it is that in the scenario that we showed, right, you've got a person that's looking likely eligible for Medicaid, but we can't exclude them from APTC because they may end up there too. And so what you're dealing with is Medicaid rules, which are based primarily on this month's income, versus APTC, which is this new thing, which is future-based. And so you can see the way that those questions were being asked. I know it gets a little bit murky at their points, but it's basically trying to establish both things at the same time to make sure you know which one you're eligible for. And that's why we try to go through that APTC part first, and if that person can establish that the projection of their 2014 income is similar to a verified source, and we're good with that, and they're fine, and they stay above the thresholds that we established for Medicaid, and those are based on different household, ways that household could be formed. Is anybody pregnant? That's a higher threshold maybe. That's all dynamic in the background. But if they stay above that range and they're clearly looking like APTC, then hopefully it's a simpler process where we're asking them just about that future. But I can understand the part where you're seeing that back and forth and wondering which one's being applied. Yeah, I can see that, and I think the feds have looked at that too. I mean, those work groups, the calls that are there, that's that question that's being looked at is you're trying to do that part to make sure you're establishing the eligibility for all the programs that may be available, but they're really different things. I mean, the future-based APTC is a tax credit on next year versus Medicaid being the right now. So it's a challenge that they're trying to look through.
Hi.
Hi.
I have a couple of questions. And I'm sure there's other people in this audience that are way more knowledgeable than I am about this whole process. It seems pretty confusing to me. I'm a registered nurse for many, many years. First of all, the Social Security number issue. I mean, it's been established that undocumented immigrants, how many are there in the state of Connecticut? There's what, 11,000 or 11, well, there's 11 million in the country, and there's a good portion in Connecticut. So in other words, they're not eligible in any way, shape, or form for this plan.
Correct.
Correct. So many, and I'm not saying this in a negative way because I support that undocumented immigrants should have some status in a health plan somewhere. Many of them might have a Social Security number that they can plug into this system unbeknownst to them, trying to get health care because they're ignorant of the fact that they're not eligible. Believe me, there are people out there like that. So what happens? It goes to Homeland Security, and then what happens to those people? Do they get a knock on their door from ICE? That's my question. Thank you.
All right, thanks for your question. No, there will be no knock on the door. What would happen is programmatically, and again, this is our program, programmatically, it would just, you get a message back on the screen that says that you, I actually think we've talked about this a little bit, Tim, about to soften the message, but you don't qualify because you did not meet one of these things. And I think some of the messages, again, from a notice perspective, we're still working on finalizing that. Would be an 800 number into the federal call center if they have questions on any of the background checks that we do that don't come out as being a positive, and so they can ask what's going on there. Sure. Sure. You want to answer that one?
Yeah, thank you. As you can clearly see, there's going to be many individuals who would go through a process like this that would really benefit from having someone to sit with them and give them some in-person assistance or help. And there's really two primary programs that are going to be available to make that happen. The first is with the exchange working very closely with the current population of brokers here in the state. These are smart, savvy professionals that do this for a living, and we have every intention of partnering with them to make sure that if individuals want assistance from that channel, that they can reach out, find a broker to help take them through the process. There is another program which is being established, and this is per statute in the Affordable Care Act, and that is the Navigator and In-Person Assister Program. And the spirit of that program is to make sure that there is a very broad network of individuals across the state who are fully trained, fully operationalized, and do receive some grant funding to make sure that they can pay for travel, purchasing laptop computers, etc., to then be in the very communities where many of the individuals who are going to engage with us reside. And so there'll be a full listing of those individuals, not only searchable on the website, as I think you saw on the homepage, certainly in working with our call center partner, people could call up and find the nearest navigator, in-person assister, or broker through that channel as well. But we are fully intent on having a very, again, sizable network of people right in the communities where folks live to offer that level of assistance if they need it.
As a follow-up to that question, I didn't see any broker information being captured on the application process. how will that information be captured?
Yeah, I'm not sure if it made it into the demo or we just didn't scroll down all the way on a page, but if an individual is using a professional broker to help them fill out the application, we have every intent to capture that information so the broker can get recognized for that and certainly get the commission.
There were two things I want to ask that you put up there. One thing is a comment about the security of the Social Security number and the rest of the information. I didn't see that little lock symbol that goes on secure websites. So I'd like to see something up there for the consumer, giving them confidence that this information is secure on this website. The second thing is a comment about the APTC. There have been some questions about that already, and there should be an explanation on the website about the impact of taking the APTC up front versus taking it at the time you're doing your taxes, because as I understand it, if the income changes to the point where the credit taken up front was more than they were eligible for, they're going to have to pay back the difference when they do their taxes. And I think that should be explained to the public and to anyone who's using the website. So that statement really needs to be there more than one time, by the way.
I would, to follow up on that, I was going to suggest, similar to some of the other comments, where you give them the option to move that arrow about what percentage, there probably should be sort of some explanation or some comment here that ties back to the point that she's making.
Great. So, Claudia, thanks for your question, and thanks for that follow-up. It just so happens, running in parallel to this, the federal, we call them feds, so I apologize, we don't want to minimize the role, but we are in the middle of a security review of our design. Began yesterday and it finishes up tomorrow. The way that the data is handled, so we all watch our spy shows and we hear top secret and things like that. On a serious note, our data has to be treated as secret and pass all of the IRS restrictions. We see the IRS as just big brother and we pay our taxes. I've learned a whole heck of a lot. They're a lot more than that. They protect that data like I've never seen before. Yes, we probably will have more. Well, generally what you're going to see is you see the little lock when you have 128-bit encryption or something else along those lines. We're having our security is going to be much more secure than that. So I just want to make sure I got that piece out. We're treating it as secret from a government perspective. And to answer the second comment, wasn't really a question, but a comment around feedback. That is the type of feedback that we are looking for to make sure that we can incorporate it into our system and make the system that much easier. So I appreciate the feedback. Yes.
Good afternoon. My question is not about taxes or insurance, but more about choices. So when you show the pages of choices the person has...
Insurance, the carrier choices near the end. Okay.
How many choices can people look at? Can they look at, compare against the bronze, the silver? Can they do that kind of thing? Or will they have limited types of things to compare to? What's your idea on that?
So, do you want... I'm going to let Jason answer this question because he's been doing this a lot longer than I have with that specific piece.
Well, actually, I was just going to go into kind of a brief summary of kind of how many plans you might even expect to see to be able to compare among, which is a good starting point for that question. So if you've been following some of the policy decisions that the exchange has made, there's 4 metal tiers that are available on the exchange. And for those of you who don't follow this, those 4 metal tiers are bronze, silver, gold, and platinum. And those are really ways to demarcate how rich the benefits are that an individual will be receiving should they purchase plans in any one of those categories. What will happen is, as we've engaged with carriers, we've set up a series of rules for kind of engaging with the exchange, and they stipulate that the carriers will need to provide one standardized plan in each one of those metal tiers that I just mentioned. Right now we have 5 carriers who have indicated to us that they are anticipating listing products on the exchange, and so 5 carriers will each be listing one of those standardized products on each one of those metal tiers. The importance of the standardized product, for those who may be curious about that, is that it truly is what it sounds like. It's a standardized package of benefits, meaning that if 5 carriers are supplying a standardized benefit package on the bronze tier, they will all provide the exact same coverage. The only real differentiation you're going to be seeing at that point is based on the carrier's brand, and then more importantly, the price. So it's a way to really help consumers make a very educated and informed decision on a very comparable product, which sometimes can be challenging today. In addition to that, in order to encourage carriers to innovate and think about different product configurations, they'll also be able to list an additional product in each one of those tiers as well. And so if you do the math, you got 4 tiers, 2 products apiece times 5 carriers. It is the end of the day, and I'm not that good at math, so I'll let you do that. That's going to give you a clear indication of the number of products that might be available. So as a consumer, when you go in, that's your sort of starting point for the product universe. And then based on some of the tools and resources available, where you can go through and select plans that you'd like to take a deeper look at, or use some of the other functionality around rank ordering by price or by metal tier, you can very quickly whittle down your set, and then also use some of the functionality to put those plans literally side by side, so you could go through each one of the benefits being offered and find out how they actually are different when you compare them to each other. So those are some of the tools and resources available, I think, to a lot of the questions that we've seen here tonight. We're going to have to make sure consumers are aware that those choices are there, and that those tools are there, and that they actually know how to use them, because they might be the best comparison shopping experience in the world, but if consumers don't know how to actually go through and navigate, they may not take advantage of those, and we want to make sure that they do.
We get actually, while you run the mic over there, we'll take this question from this one right in front.
Back on the carrier question. So, how are the plans going to be displayed if I'm not?
On the carrier question, how are you going to pull up the different options? Is it going to be by price first, or have you decided that?
It'll be price first.
Okay, and then they can whittle down however they want to look, right?
Correct.
And then my second question is, when you went through the demonstration and you said, would you be interested in a subsidy, like most people would probably say yes, are you going to do anything to basically say something like, if you don't fall in this range, don't bother, so you don't waste somebody's time going through the whole thing, and at the end say, this was a futile attempt?
That is one of those areas that we see a lot of feedback that we want to make sure that you're not doing anything that is a futile attempt, because I agree. Yes?
Yeah, you made it seem very easy on that 2-year-old child married that got on Medicaid. We work on applying for Medicaid. It's usually a very tough process. It's not that simple normally, and there's verification that has to be sent in. That seemed like you granted her just like that. Is that the way it will be?
So what I can share with you related to that, and Tim, I'll ask you to pile on here, is this system does the eligibility determination. Now, there may be other things. So what does that mean? What does eligibility determination mean? We've entered all this information. We've entered in, you've entered in your name, your address, all of those types of things, as well as answered all the questions. Out the end, and again, in our first phase, there's multiple phases of this initiative, but in our first phase, we will then be doing a handoff with, the Department of Social Services, that chip process would then continue on. I can't speak to what happens in that process, but as it exists today, it would continue to exist tomorrow.
That child wasn't there, it was just the beginning process. Yeah, so one of the things though with this whole process is actually, it does change things quite a bit. So the MAGI-based eligibility, the modified adjusted gross income determination type, it really does change a lot of things about, there were those special kind of circumstances you could claim and things like that. A lot of that's been removed. It's all very standardized. And by doing that, that Federal Data Services Hub that we talked about really does, if all the stories are true as we're moving through the testing and everything, it really should provide a lot of that information that we should be able to see. And when I say see it, I mean the system should see it. So if you've said certain things along the application process and that's squaring up with what we're seeing, a lot of that paper process, things like that, we're very goal-minded that that's not going to be part of this. That, on a happy path, you should be able to move through this, and these electronic sources should do what mail used to do, in terms of back and forth and things like that. So that's really the goal. It's not to say that there won't be some, but, we try to get some too.
This is related, continuing on the Medicaid thing. At the point at which you've gone through that and the screen shows up and says this person's probably eligible for Medicaid, is that when you've applied for Medicaid, or is there another process? Because the date you apply for Medicaid makes a difference. And I felt like you guys sort of like threw them off and said, okay.
No,
Medicaid.
we are actually having some pretty significant conversations around that topic. I know when I left the office today, the whole operations, making sure we understand how every piece of handoffs, if there are handoffs, between Medicaid and the exchange as it would be working when we roll out in October, are covered. So that being said, Tim, I'm going to ask you, because you're going to know the exact when, the day they apply, that answer.
And there's a couple of flavors of it based on the channel that you applied through. So we've talked about this online application. I didn't mean to exclude the fact that there's still paper-based process where you can submit the application via paper. So that file date, just as it always has been, is the date that the agency receives the application with name, address, and signature is the file date for Medicaid for those clients. In the online application, it is going to be the date that you press submit on the application. That's the day you say, yes, I did want this thing. And you'll also notice that happens pretty much right after the signature part. So in lockstep, we're getting that signature, you're pressing that. That is basically the electronic version of that same process.
Yes.
We're all thinking the same thing here, but just to be clear, because I can envision a scenario where the person goes through and even someone helping them, and they come out after the analysis, they're eligible for Medicaid, and you say, okay, good, you're all set. Is it your expectation that what will then happen is that the agency, DSS, or whoever follows up on this is going to follow up, is going to contact the person. There is going to be an automatic follow-up. Is there going to be a next step? Is there going to be a time frame as you outlined in terms of this application process? There would be follow-up they would hear if they were just going to go through the exchange. Is because the folks who are in this situation are the very people who are not the kings of follow and queens of follow-up. And so they're going to sit back then and wait and expect that it's going to work.
So just a couple of things on that. There'd be some, again, there's, all these permutations of this. So on an instance, if we're talking about a client that maybe still needs to provide verifications, they're going to be, at the point where they're made eligible, they're going to get a notice, first of all. At the same time, basically a notice is going to go over to DSS, to enter them in the EMS system. That'll take place, and that'll be from that date that they filed with the HICS. So that's all being captured along the way. And then those clients, as of right now, are going to have up to 90 days to get those verifications in, that anything that was not able to be done electronically, things like that are still required. And it's every one of them is a little different in terms of what requires attestation, what requires a paper document follow-up, but they'll have up to 90 days. And at the 30 and 60-day marks, we're going to be sending them notices that they need to follow up if they haven't already, and what are the things outstanding. We're also putting in a process that if they were to send us something and they thought that that thing met the verification criteria, but ultimately the workers are seeing that it's not meeting it, they'll still get a notice. Instead of waiting for the 30th or the 60th day to do that, they'll get a notice saying, we appreciate you having sent this in, but you're going to need to send in X or Y to give them that notification. So those are processes that we've put in place. And again, going back to the email and mail and all that stuff, that's all being worked out so that clients are treated the same regardless of how they've indicated that.
Hi, I have a couple of questions. Those numbers that were rolled out for the subsidy and the $1,200 and the $150 premium, can we assume those were fictitious numbers?
Yes.
Okay. If someone does not file...
Actually, I'm going to hold that thought. We actually had a conversation based on the earnings. Based on earnings, I thought we had, I'm not sure those numbers are as fictitious as we think they are. I'm not sure, because based on what they earn in that year and the maximum amount that they would have to pay, have to pay, the numbers aren't as fictitious as we may think they are, just because of the salary.
How old were the individuals, the two individuals that...
Over 18 and two over 18, one under 18.
Okay. If someone doesn't file income tax, how is that handled?
So that takes us down the path of self-attestation over your earnings. So it's just one more thing that if we don't find you in the system, then it's going to bounce out and things become manual.
So in order to be eligible for the subsidy, you have to file income tax, correct?
No, well, yes, in order to get this, for advanced premium tax credits, you have to be paying taxes, because that's where that is coming from.
But
Okay.
Jim, just to add on that, I mean, it doesn't, if you were to answer that question along the way of I didn't file taxes, it means and I don't intend to file taxes in the coming year, you're out of the APTC part, but it doesn't exclude you from going through the Medicaid screening and things like that.
Well, you could have had a child who was filed under their parents the year before.
Yeah, and if there's any number, I might ask Tim to even step up on some of that, but there's a lot of permutations that have to be accounted for in that rules engine part, so that's why we establish those relationships. We also gather all those tax filing statuses, things like that, and what you didn't really see in the demo was we looked a lot at what Ashley was doing, but we also collect similar type information for the other individuals to make sure we know exactly what every person was doing in each of those important years.
I know that you mentioned that, brokers and navigators will be there to assist, and there was an 800 number. Are you actually going to have a drop-down menu where there's going to be agents and brokers listed in a geographic location that they can tap into, or how will that work exactly?
Yeah, all certified brokers and navigators will be listed on the site, and there'll be a geographic search feature to find one closest to you. And you could also search by name if there's a particular individual that you wanted to check and see if they were part of that program.
Okay. Income for self-employed, will it be net? When someone is filling that information out, someone's self-employed, it's going to be net, not gross, correct? Because when I went on the Access Health CT site, there was a calculator, and it didn't differentiate. It indicated for someone who's an employee and an employer, but nothing on self-employed.
Self-employed, just filing as an individual?
Correct.
Have to double check, but I'm pretty sure if you go to the calculator, you should have the option of just indicating I'm applying as an individual and entering in your annual income.
Right, but that's my question. The annual income, would it be based on net or gross?
It's gross.
Gross, then no one would qualify then. Okay.
Okay. We'll take a look. I was going to encourage folks, if you haven't, if you do go to accesshealthct.com, there is a calculator on there that, given the current information available, you can get a pretty accurate projection of what you might expect to both receive in terms of tax credits as well as what you might pay in premium. Again, that tool continues to be refined as better information comes available, but at least for most folks today, you can get a pretty good estimate. There's obviously some more specificity that could be baked into that tool, but right now, again, it's meant to give a kind of broad overview to folks given the information we have.
And one last question. You said that the comparisons are going to be available. When they pull up the comparisons, how will those be viewed exactly? You're going to have the metallics, and then you have probably 25 different plans. So how will those be categorized? And will they have the details or just the high-level benefit outline that you indicated?
So you'll be able to select plans across any configuration, 3 at a time, and that was determined based on actually a lot of research that's been done in conjunction with other institutions such as Consumers Union and other organizations. If you have too many plans, it's very difficult to display on a screen, and it can become overwhelming. So 3 at a time was kind of deemed to be an appropriate one. Again, you'll receive all the information, and actually they'll be kind of grouped into different categories, so you can find a particular area you might be interested, click on it, and then get the full detail. But we wanted to be cognizant of the fact that given the huge amount of information for some of these plans, we didn't want you to have a scroll bar that, as you go down the screen, just becomes very difficult to navigate. So you can collapse things and expand things as you see fit.
This is a recommendation you can show side by side. If you have 5 characters and 5 town plans, you should be able to see that on each screen. I don't think the users and people scroll through. Otherwise, 3 times at a time, you're going to have multiple screens open, and will be very difficult to differentiate. Just a suggestion.
Sure, it could be something we could test again. Folks who really specialize in this area, when you do get 5, given the kind of information we're putting up there, it can be very challenging to fit stuff in boxes, and it makes it very challenging. So, 3 at a time, hopefully is going to be helpful. Certainly we can think about other options.
For that, though, there are some online entrants that comparisons that actually pop up the highlights of what is different. So if there's any capability for you to do that, that probably would be helpful.
I like the cleanliness of the screens. A couple of comments. One is on the word apply at the very beginning. If I were to see that, I would think of that as, would I qualify from a health standpoint in the application? And I wonder about people not feeling like they should even try. And that maybe the question is something like, can I buy insurance on the exchange? Not can I apply, so that there's no fear about medical underwriting that eliminates people from even thinking about looking at the products. The second thing is a couple of the questions that you go through at the beginning, I wouldn't have any idea what the answers are, and they're yes/no questions, like the deductibles question. So my approach would probably be to pick one, try it, go through, see if I could figure out, intuit somehow what the implications are of each path. And I wonder about adding a third radio button for a couple of those that says, I don't know. And then when you get the I don't know, then it gives you some indication of the implications of the answer to the question and how to answer it. And I realize that's really complicated to do when you're trying to keep the reading level as lower, but just to have some idea, because I wouldn't know, even though I've been involved in this for a while, I wouldn't know how to answer some of those questions or what the implications would be.
Just to respond quickly to the comments there, I think this theme of which words you physically choose is a very important one, because words can be interpreted in a multitude of different ways. And so, we continue to be very cognizant of that, and that's one of the things that we would be looking to evaluate and test as we, get this experience in front of end users and ask them to go through. It becomes very evident, to your point, to see where people are struggling, and that's one of the primary sources where we can get some great feedback. The other thing that I think you really highlight too is from a marketing and communication standpoint, getting people well prepared for what they're going to encounter when they go through this process is going to be really important. And so we're going to be spending quite a bit of time making sure that folks are up to speed regarding documents you may want to start gathering before you even get to that process, because obviously it can be quite frustrating if you're ready to go, you get to the site, and then you find out that you actually had another 20 minutes of prep work that you weren't prepared to do. That can actually derail a lot of individuals. So we're going to do our best to make sure that we are really getting folks well prepared for what's going to be coming, so they can have a good experience and move through it hopefully quickly and not get stuck constantly going downstairs to the file cabinet throughout that process, which would not be ideal.
Where does dental figure in all this?
So for children, dental is included in the medical coverage. For adults, we're still working through having dental on our site as another offering. It is dental for adults is not covered as part of the Affordable Care Act, but is something that we're working through to see how we can add it to our site as part of our October rollout. And we do have a few dental plans that are very interested in participating.
I have a question on brokers. You mentioned you'll have the ability to select a broker, but not all carriers, compensate all brokers. Not all brokers are licensed and appointed by all carriers. So is the expectation that the selection of broker in the screen will be a function of which carrier has been selected?
As part of the policy that was established in order to ensure consumers got the best service from any channel, as it related to brokers who want to be able to enroll and participate with the exchange will need to be appointed with all the listed carriers, and that's the mechanism for addressing that. It would be, it's probably up to the broker to go out and make sure that they're licensed with those carriers who are going to be listing products on the exchange.
Jim, I was just going to say, our video team was trying to ask that people can speak into the mic so that everything gets recorded and picked up as we're going through. So we'll just pause a little bit and make sure they can figure it out.
When someone has completed the application and they're not going to be Medicaid eligible, do you have an expectation of what the turnaround time is before they actually have medical health insurance coverage?
So I believe right now, it'll depend on the date that you apply. If you apply before the 10th of a month, so the 15th, thank you. Yes, I get it. Then we would expect you to be eligible by the end of the beginning of the next month. So if you applied by the 15th of February, March 1st, you would be effective. Right now, we're working through SLAs with the carriers to make sure they have X number of days to get a letter out to you so that you can pay. And we're working through, make sure payments are, whether by check, by credit card, all of those things. But as long as you apply before the 15th of the month, we expect you to be able to be insured by the beginning of the next month.
Just to put a further point on that, obviously we have an open enrollment period which starts in October of this year and then goes to the end of the year. But just to be clear, if you applied on October 2nd, that does not mean that your coverage starts November 1st. The fourth quarter enrollment period is looking to get people enrolled for coverage, which begins January 1st.
Hi, I'm interested in hearing more about how people who are determined eligible for Medicaid get enrolled into Medicaid. Are you saying that the exchange is actually going to talk to the DSS system? And if not, how is that information getting transmitted?
Yes, the exchange is talking to the DSS system, and we are two or three step process. And when I say my 2 or 3 step, I mean different deliverable dates. Our first process to go live, because the DSS system is in the middle of a modernization project, is to pass a document that comes out of our system. So a report that says, Jim Wadley, all my information, that they can take that information and enter it right into the Medicaid system. They will have SLAs that are the same that they are today, whereas if you apply today, you're service level agreements. Thank you. Thank you. So when you apply today, you're active today. Same thing that goes in for Medicaid. In the future, as the modernization project continues to roll out, there will be a seamless technological integration that is planned within 2014 and 2015 in steps.
I just have a suggestion about the tribal status page. So you know why you're asking the question, and lots of us know why you're asking the question, but will they know why you're asking it? Will it seem like arbitrary and discriminatory? Could just a couple words, here's why we're asking, you're eligible for extra, rules or whatever. Just a suggestion.
I think there's an opportunity, and the comments like that are excellent. There's certain questions up here that I think some consumers would probably ask, why am I being asked this question? And so if there's an opportunity to further clarify that, we'd certainly look into that. Thank you.
Hi, I just had a question about providers. I noticed, I think on the last few slides, there was an option for selecting or choosing a provider. So I'm wondering what happens when the applicant clicks on that button. Are they going to get a list to search by? Are they going to be taken to the carrier's website to select providers? And the second part to that is, if that's the case, if they're going to be taken to the carrier's website, are there other places on the site that are going to link over to the carrier's websites?
So I thought I could answer all your questions until your last statement. So the first answer to your first question is, yes, we will have links from each carrier into their provider directory searches so that you can select and search for specific providers for their plans. I'm trying to quickly think if I anticipate any other links, and I am not coming up with any other links to the carriers unless we want to go into more information around the plan design. Can you grab the mic?
Sorry. So at the very end, when you see the confirmation of your enrollment, there's a link to the carrier with which you're going to be enrolled with. And also on the plan details pages, so when you're comparing a plan, if you pull up just the details of one single plan, you can also link to that plan's website.
Thank you.
Hello.
Hi.
I have a question about whether or not there'll be proactive
messaging about renewal, and I know it's jumping ahead, but I don't think it's too early to be thinking about that. And I also wondered, along with that, how do people report changes? You know, it's a low-income populations are transient a lot of times, and so how is the website designed to be able to capture changes in address, income, all those sorts of things that will be happening?
So after, what we didn't really get into was that user created their account there right at the beginning, or they had already. From that user account page, they'll actually have a couple of like actionable options to go either report a change, or in future instances, there would be a renewal link there if they're up for renewal. Now, to get at your, your specific question about kind of forward-looking renewal, actually within the ACA itself, it's actually very descriptive about the process that needs to be put in place. And so what you'll see is that actually when people come up for renewal, actually prior to even sending them the notice that they're going to enter into their renewal window, the ACA actually says that you need to go ahead and use those external data sources, see what things may have changed, and actually run a pre-eligibility for them so that the notice that goes out to the client says, based on what our sources are seeing, we think you may be eligible for this coming up in the next year. And hopefully that process, if it works the way it's intended to, it's a check, it's a sign, it's a move it back through and say thank you, and they're good for the next year basically. So it is fairly well thought out in the regulations about it, and then we just have to make sure that the services hub works and we're able to retrieve that information that way. No?
For brokers and navigators, since we didn't get to see that portion of the final screen, can you share with us what information you're capturing? Is it broker TIN? Is it NPN number?
Right now, the plan would be for broker TIN in order to make sure that we can use that not only to verify the broker, but also to help facilitate any commissions that might be paid.
I got a question about the healthcare bill, and as a broker, we have to provide SBCs to clients. Is that a thing that's going to get printed out, or you're going to produce a PDF file on that that somebody's going to be able to take and read, or summary?
The summary of benefit coverage?
Yeah.
I actually don't know the answer to that, whether there's a requirement that needs to be printed and handed out at the point of contact. I don't know the answer to that. We'll all have to know that.
I have a question. You mentioned certified navigators who will assist with the choices that people will be making. What's the criteria for certified navigators?
So there will be a training and certification put in place for individuals who want to serve in that navigator function. And the goal of that certification process is actually twofold. The first is to let the end consumer who might be engaging with the navigator know that individual went through some training so that they know about a lot of the technicalities behind how tax credits get administered and some of the eligibility rules, that they're familiar with the website. And so we think that it's important for consumers to know that the individual that they're working with has gone through an official process to get up to speed. And then obviously the other part is for the benefit of the navigator themselves. And so as we think about the folks who we are looking to engage with, and really again, be in the communities where individuals that hopefully will find these services to be useful reside, they may not be people who typically get themselves involved with determining eligibility for a tax credit, or may not be an individual who traditionally navigates sites like the one we saw. And so we want to make sure that if they're excited and they're looking to engage their community and provide this important service, that they have access to training to make sure that they can be successful. And so that's really the goal of putting that kind of training and certification program together. Yeah, so it's a great question. So the parameters regarding what that program and that training certification program will look like are being developed as we speak today. As you may or may not know, we have a memorandum of understanding with the Office of the Healthcare Advocate, which is Vicki Veltry's organization, to help us administer this program. And that was really done because of the great work that organization does on behalf of consumers every day. And so she works with many of these individuals, many of the organizations who are likely going to raise their hands to become navigators. And so, having the endemic knowledge of her organization at hand to help us put together a meaningful training and certification program, I think is going to be of a big benefit to everybody. So we're working with them to put that program together. It has to be fairly comprehensive. This is not an easy process to go through, and so it'll be a mix of in-person training, given the level of complexity, as well as some online training, webinar-based training as well, to make sure that we can cover all the bases needed. It'll be in multiple cities. It'll be over multiple weeks to make sure that we have a program in place that's not, centered in one city where we're requiring individuals to travel, but something that is really broad-based to make sure individuals in all four corners of the states can get access.
Two questions. Since the first year of open enrollment is, it's extended from October to March, can clients go in there and change the carrier that they want? And if they can, is there a limit to how many times they can change their plan?
Right now, once you enroll with a carrier, you will be a member of that carrier until the next open enrollment period comes up. Obviously, we've talked a lot about the fourth quarter enrollment period, so we are highly encouraging folks to, get out in front of this and really start the year with coverage. It's in everybody's best interest to make sure that, you begin as a covered individual in January. So the fourth quarter period is quite important. There is an extended open enrollment period this very first year, so it does extend into the first quarter. If for whatever reason you weren't able to go ahead and enroll in coverage in the fourth quarter, you do have an additional 3 months to do so in the very beginning of the year. But once you select the carrier, that is your carrier of choice until the next open enrollment cycle comes up. If for whatever reason you decided to cancel that coverage and not be a member of that policy anymore, you could certainly do that. But just because you choose to cancel does not mean that you can then go back in and select a new plan and change carriers. You would have to wait until the next open enrollment period commenced.
Okay, perfect. And I have one more question. If they select a plan and that information gets sent to the carrier, and like you said, it's the carrier's responsibility to collect that first month's premium, if they never send the carrier the premium, whose responsibility is it? The exchange, or marketplace I should say, or the carrier to notify the client that they no longer have coverage?
In that particular situation, that's going to be a carrier issue. Again, the exchange, we do not collect any money from any individual. We have no infrastructure set up to handle financial transactions of any kind. And so, certainly it's in everyone's best interest from the carrier and the member perspective to make sure that payment's delivered to start coverage, but that is a carrier member issue.
So even though they were never really eligible or active, the carrier is the one that still needs to notify that client.
If they've applied for coverage and are going to be enrolled in that plan, they need to get that payment in.
Okay, but if they don't, it's the carrier's the one to tell them that you don't have coverage.
Correct.
Okay, thank you.
Hi.
So hold on just a sec. So only because I just happened to glance through, excuse me, the sign-in sheet. If you are a carrier and representing a carrier in the room, I would encourage you that through the webinars that Julie Lyons is doing as part of your plan management, that you continue to ask your questions of her and make sure you validate those things. And don't treat what we're saying as gospel. I'm telling you that right now. She is gospel. I just implement the stuff. Okay, now we can go back to questions.
With the extended open enrollment period, does that mean that they can, if someone applies in, say, February 15th, they can go retroactive to January 1st, or
No.
would it be the following?
It is going forward. That question I know has been answered in the carrier meetings. That would wreak havoc in the world.
Just a couple of definitional questions that I don't need the answer to, but you will when people are filling in the forms. When you said combined income, I automatically thought, is this gross income? Is this adjusted? Is this taxable? And then when you did the income by month or by, weekly income, again, it's take-home pay or gross pay. People need to know to get the answer right.
Okay, thank you for that feedback. All right, a couple more minutes, a few more questions.
Just one quick question on the status of navigators. So will they be quote unquote authorized or encouraged to recommend specific carriers and specific plans like a broker would do?
That's a great question. I'm glad you asked that. The answer is a stark no. So, well, navigators might be very helpful in terms of, getting you somewhere where you can actually sit down at a terminal or a computer and fill this out, maybe make sure you got the right information. The way that we formulated this program, we are expressly prohibiting a navigator from recommending a specific plan or a specific carrier. That is not the goal of the program. It's not the intent of the program. If you're looking for that level of service and want that kind of help, I'd encourage you to reach out to a broker.
A couple more questions.
Staying along the same theme of questioning brokers, many of our brokers don't have TINs. They use Social Security numbers. So I worry about them entering that into this form. So just a point, I'd like you to consider NPN number as an alternative.
Okay, thank you.
I read that the national producer number is going to be used on one of the reports that was done by the exchange.
Okay, thank you.
Just a quick question about non-U.S. citizens. He said if you're not a U.S. citizen, it's going to kick you into a world of having to verify certain things. But in what instances would a non-U.S. citizen be eligible to participate? Permanent resident? Someone on H visa?
Tim, do you want to answer that?
There are a number of citizenship criteria or alien types, if you will, or immigration status codes that could be eligible. Permanent resident is one. Undocumented, obviously, is not, as we've said. And some of those requirements vary by program or by type of subsidy. Okay, so for example, Medicaid has a 5-year bar with certain exceptions to that 5-year bar for children and pregnant women. So we enforce those rules through the rules engine. And as I say, we can enforce those Medicaid rules separately from the APTC rules where the policy varies slightly. If they don't want the subsidy at all, they can still buy insurance. Yes,
Well, hold on. So if they qualify for Medicaid, they don't qualify for APTC. If they just want to buy insurance to the exchange during our open enrollment or during a qualifying life event, yes, they can do that as well.
Right. There are citizenship or alien criteria we validate as part of that as well.
Right.
And the criteria for participating in the exchange that we validate is the same as that for the APTC. Lawful presence in the United States.
One last question. There doesn't need to be one.
So one last question on brokers. So you mentioned that brokers need to be licensed with all carriers on the exchange. Will brokers be expected to be objective across all carriers? And if so, are there any guidelines on their commissions?
I think
sure there's brokers in this room that do
Actually, I'd encourage you to reach out to some of the broker associations to find out how they treat that. I mean, you're getting into now an issue around, ethical conduct, codes of conduct as it relates to brokers. Certainly, the insurance department, oversees the issuing of licenses for brokers and has a whole, slew of plans around that topic. As part of our own broker training, certainly we're going to reinforce ethical behavior. But that's probably a question that's more akin to be asked of some of the broker associations or certainly the insurance department.
Okay, thank you.
All right. Thank you very much for coming out tonight. I appreciate you taking time out of your busy schedules to take a look at our application. We encourage more feedback. Have a good night.